Okay, doctorarjaybe here, and I wanted to discuss congestive heart failure. Now, the heart normally, pumps the blood fairly easily throughout the body. It does its job without any assistance, and of course, it does this job, for sometimes 80 to 100 years. It's a muscle that works remarkably. Most muscles in the body cannot contract like the heart can for the extended periods of time without getting fatigued. The heart has the ability to do this all day long, 24 hours a day, and for years. But in certain conditions, the heart muscle becomes weakened. The heart pump doesn't pump enough to clear the blood properly, and so there's a backwash of the blood. This can cause a problem with the kidneys and can cause problem with the lungs. If the kidneys don't get enough good blood flow, the kidneys can't remove the waste products properly, and so the kidneys can actually have problems with chronic kidney disease. The lungs, if the blood backs up enough, will back up into the lungs, and there can be some fluid in the lungs. So somebody with congestive heart failure can have problems with their breathing, and they can have problem with kidney disease. In addition, depending on the type of heart failure, sometimes people will notice it because they have fluid in their ankles, and the treatment for that would be diuretics to remove the fluid. The fluid in the lung also can be removed with diuretics. Then there are medications that can strengthen the heart muscle, make it pump better, and this can give long-term relief to this condition. Most common cause of congestive heart failure is coronary artery disease or blockage of the arteries around the heart, especially that caused by cigarette smoking. So chronic congestive heart failure is one of the conditions that can be caused by smoking cigarettes. The next most common problem would be alcohol. Alcohol can damage the muscles of the heart and cause them to become weaker. And to a certain extent, if you stop drinking, your heart function will improve. The next most common cause of congestive heart failure would be viruses. There are some viruses that can attack the heart cells and cause congestive heart failure. Usually in this case, you cannot bring those heart cells back once they've been damaged. So the person who has a injury to the heart with a virus typically has to restrict their activity, and as long as they take good care of themselves, everything should be fine. I had a patient of mine who had a viral-induced congestive heart failure, where his heart function was barely adequate to do anything. He took good care of himself, got a little bit of moderate exercise, cleaned up his diet, took care of any problems with alcohol or cigarettes, and he did fine. But the condition was really still there, so that if he did anything extreme, he would pay for it. I had another person in my practice years and years ago who was a young fellow. He was doing marathon training, and then one day he got sick, and then after that he wound up in heart failure. So I saw him in the intensive care unit, and this was somebody who was in a pretty poor state. Now, this was during my training, so I'm not sure whatever happened to this gentleman after I saw him in the hospital. Um, uh, so it's very possible that he went on to live a normal life, and recovered from his viral illness, and the heart function recovered. We have seen this with the COVID epidemic. That people will have problems with their hearts function because of the COVID virus. And then later on, when they recover from the COVID virus, their heart function returns to normal. So sometimes the condition with the viruses can be temporary. Sometimes it's a permanent state. In any event, if you do have this weakness of the heart, it's going to be important to restrict the activity level, and of course, talking to your cardiologist or primary care doctor to help you with this, to determine that, and also doing some testing like stress testing to try to determine what your body can tolerate. And then they can give you a level of, okay, you can do this much, but you can't do that much. Okay, so a little bit about congestive heart failure.